Hello, everybody. My name is Arya Javidan, and I'm the Program Coordinator for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is on Lifeline Pediatric Teledental Program for Nicklaus Children's Health System. Today's webinar is being hosted by the Southeastern Telehealth Resource Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs, and they are presented on the third Thursday of each month. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. Just a few tips before we get started. Your audio has been muted for today's webinar. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please note that closed captioning is available and is located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel. With that, I will pass it over to Boyd Mark, Program Director of the Southeastern Telehealth Resource Center.
Thank you, Arya. My name is Boyd Mark with the Southeastern Telehealth Resource Center, and sorry, I have a bit of a confusing name. I'm the guy with the backwards name. If it sounds confusing, don't feel too bad. Mark is my last name, Boyd is my first name, and I'm very privileged to be here today, along with my colleague on the call, Lloyd Sermon, to introduce you to Evelyn Terrell, who is the Director of Telehealth and Special Projects at Nicklaus Children's Health System, and Allie Leverson from Pulsewrx, who is administering the Lifeline program. And we have been all working together to develop a program to provide more accessible primary care and teledental services to some of the kiddos that Evelyn and her organization are working with. And it's a program that the Southeastern Telehealth Resource Center is very proud to work on. We also have a number of different programs, including things like our Telehealth Learning Center, which, for example, today we took to the Mercer University College of Nursing, and we did a series of Telehealth 101 programs for the master's level nurse practitioner students. Those are the types of services we offer. And I'm going to ask Arya to just go to our website very quickly, show you our website, and play a short video that tells you about us. There we go. There's our mobile learning center. And after that, we're going to turn it over to Evelyn so we can learn more about this exciting program that we are able to do thanks to Nicklaus Children's Health System. So if you want to get that going, Arya, that would be terrific. Okay, thank you. And for any of our folks tuning in who are in Florida, Alabama, Georgia, South Carolina, Puerto Rico, or the Virgin Islands, please don't hesitate to contact us if you have any questions about a school-based telehealth program or any deployment of telehealth or questions about regulation, licensing, and reimbursement. We would be happy to work with you as part of the National Consortium of Telehealth Resource Centers. And one of the most absolutely exciting programs that we're privileged to be part of now is to be working with Evelyn and her team and with the Pulsewrx team on the Lifeline program. And with that, I will turn it over to Evelyn.
Evelyn, I still think you're muted.
Hi, can you hear me?
Yes, now we can hear you.
Oh, excellent. Good afternoon, everyone. Thank you so much for having me. It's a pleasure to be here. I'm going to share my screen to go over a quick PowerPoint. I want to make sure that you can all see that.
Yes, but it's showing in the presenter view.
Yeah, I'll do that again. See. And is that better?
Yep. Now
There we go.
Okay, awesome. So I represent Nicklaus Children's Health System. I've been with the organization for over 20 years. My background is in occupational therapy, and I transitioned to the telehealth areas in 2013 when we opened our telehealth center. And since the pandemic, I have been solely dedicated to telehealth, whereas in the last 7 or so years, I had other areas of responsibility, rehab services, global health international, and other areas, but solely focused on telehealth and other special projects, affiliations with other health systems, and growing our virtual care services. So just as quickly, I'm going to go through some slides very quickly just to give you a little bit of about our health system. We were formerly Miami Children's Hospital. We've had some name changes over the years, but focusing on in South Florida, we have a network of ambulatory care centers that spans 3 counties and growing. And so we have over 20 locations, but our hospital is in the Miami area. We have all of these locations that I mentioned, tertiary, quaternary care, and really comprehensive care. Many of our ambulatory care centers have multiple subspecialty areas and services, as well as primary care and dental and other services. This is a little bit about our mission and vision, and ultimately we want to inspire hope for every child, and definitely part of our growing strategic initiatives. It's all about serving the child, and virtual care is part of that, being where the children are, where they learn and play. These are some stats of our organization. Licensed beds, so you can see we have 309. We are have one of the biggest and most busiest emergency rooms in the country, almost 100,000 visits a year. And these are some of our physician group, over 800 physicians. And I'm going to go through these because I know we have a limited time. Our Lifeline team is also very a big component of our health system, transporting children from throughout the state of Florida and outside of the United States, even from the Caribbean and some of those sites and neighboring countries as well. We have a Pediatric Advanced Care Pavilion that opened in 2017. It's really about enhancing our 16. It enhanced our capacity to see inpatients and really create a unique and different experience, larger beds, private rooms, and really state-of-the-art facility. These are some of our institutes. This is something that has been growing and building, and we're building on that strategy this year, opening and enhancing on our ability to provide comprehensive care for very specialized institutes and centers of excellence, related to these disorders or conditions, orthopedic, heart, and cancer and blood disorders. We're a teaching program and the largest teaching program in the Southeastern United States. And we have great partners, Florida International University, NOVA, and others. These are some of our U.S. News rankings. So we're very proud to be a top children's hospital in the state of Florida and nationally. And these are some of the areas where we have shown excellence and excelled in the quality of services that we're providing to our patients. So a little bit about our telehealth program. And when we talk about telehealth we know has so many benefits, from increasing access to care, continuity of care, convenience. And so I'm going to share some of the statistics and some of the highlights of our program and what we've been able to accomplish. These are some of our metrics, results, visits. We have over 24 subspecialty areas that are currently participating in telehealth, very high satisfaction, and over 190 providers that are participating within those 24 specialty areas. So on patient satisfaction, we administer our hospital-wide Press Gaining survey, has been in place for years, but in 2020, we were able to expand it to also include a telemedicine survey. Prior to the pandemic, we had surveys that we were administering on our own, whether it was secure email or surveys that were being completed either manually or electronically when patients were seen, such as, for example, in our school-based program, we had a process in place to be able to capture that voice of the customer in the school. But again, since transitioning to Press Gaining, we've been able to gather information, really comparing us nationally and also comparing in-person visits to virtual visits. So if you can see here some of the statistics, all of the questions that are the same questions on the inpatient survey and the telemedicine survey, score higher for telehealth. And one of the questions that you can see, the second one, the first and second, the ease of scheduling an appointment, the ease of contacting us and the clinic scores significantly better for virtual visits. So it really, again, it emphasizes and highlights the convenience factor, again, those benefits that we discussed. Another tool that I wanted to share with you is our distance travel tool. This is something that we also developed in-house and using some Google tools and analytics. And it really just measures, it's based on zip codes, measures the distance from the patient's home to our clinic, our main campus facility. And these are savings for this select period of time. In 2021, we pulled this, and so you could see how much of an impact this can be from a cost savings perspective for the family. Of course, this is just one piece of the pie. This is just one piece of the savings strictly related to the patients and families having a reduction in travel. There's so much more that we could also highlight with regard to telehealth, whether it be reducing expenditures to the healthcare system in general, right? Diverting an inappropriate ED, emergency room, or urgent care visit, decrease length of stay or decrease in readmission, and so forth. This shows some volume based on subspecialty areas. So our largest percentage of volume right now is in the mental health services area. So if you see psychology, psychiatry, neuropsychology at the very top, followed by nutrition is another very common service. And then we have about 17 subspecialties that are participating in telehealth, but here on this chart are really those that are having the highest volume of consultation. So we see allergy, immunology, gastroenterology, adolescent medicine, genetics, and so forth. And this is just a breakdown of our pie based on our type of service. So if you see 51%, that again is a combination of those top specialty areas that you saw: psychology, psychiatry, neuropsychology. Again, those 17 or so subspecialty areas account for 33% of our volumes. And then we also have a percentage of rehab visits as well as primary care. Prior to the pandemic, I would say over 80% of the services that we were providing were primary care related. And a great deal of that volume was coming from our school-based program, which unfortunately took some kind of a pause, and we saw a significant reduction also in that volume because of the pandemic, school closures and just changes related to the pandemic. And so we've really switched that the percentage and types of services that we're providing as comparable to pre-pandemic. So I wanted to show you this roadmap. We've been on a journey to improve our telehealth platform, and we had a platform, a proprietary system and platform that we had built homegrown before the pandemic. But we quickly realized that we really needed to invest in the technology in our platform and continue to improve to make sure that we were addressing all patient needs, that we weren't leaving any patients behind and addressing social determinants of health. So this is our goal, is really to enhance our platform. It's been a 2-year journey because as you all may know, especially when you build, right, when you decide to build and versus buy, it takes an investment. It takes strategic alignment with hospital strategy and goals. It takes investment of time and resources. And so we've been improving our platform throughout the pandemic, but we have this timeline specifically is related to our phase 2 and 3 really deployment of our platform and enhanced platform. We've already gone live with what we think is an optimal platform that is now integrated, interoperable with our electronic health record. That went live in August, and then we've made some enhancements that I'll share with you, such as in language, so having our platform available in English, Spanish, and also Haitian Creole, which is our third most spoken language. Over 70% of our patients are Hispanic. Again, being in South Florida, a very large Hispanic population, so many of our families are not proficient in the English language. And so that is an important component or feature of the platform that we thought was, again, very important. And so the virtual interpreter that you see here also in this roadmap is something that was another enhancement. We had, of course, interpreter services available to our patients. It's something that we need to provide by law, but we enhance on that platform so that now we can bring an interpreter live in these encounters, enhancing the experience versus a phone call. So again, it's about improving the experience. This next slide, it shows our implementation plan and milestones and a few other enhancements and opportunities that we've been leveraged. So today we wanted to highlight our Teledental program, as Boyd mentioned. And in this slide, we have our Lifeline program being launched this December is what our internal goal is. And I know we look forward to partnering with the Resource Center and Pulsewrx to make that happen. And it really takes a village, takes alignment with multiple areas of our organization. And our dental program is one of those that is very much aligned. Our dental program, there's 2 programs. So there's a value-based program that is actually a HRSA-funded program that our dental team had already been deploying. And so we have identified a very underserved population and also the value-based program, but another dental initiative that we have with a rural community in the Homestead, primarily in the Homestead area of Miami, very much the very far south, right before you get to the Florida Keys. There are early learning centers, and that's the second population of dental that we're serving for teledental services. So we've identified, in essence, 2 pilot groups that are receiving teledental services, this rural community and those that are part of the value-based, as one of our initial pilots. The second or the third, if I may, it would be our primary care team and department. We have primary care providers at our main campus and also ambulatory locations. And we have a new initiative that we've partnered with also our community relations department and some external partners to identify those families that are reporting food insecurity as a concern. And so we're identifying those patients that, again, have very much needs, and we need to address some of those social determinants and targeting those populations to launch our program. These families could certainly use the benefit of having this smartphone device that can be used not just for telehealth services, but other health-related services. And this is something that is part of our roadmap. So when we look at these milestones, we're talking about enhancing the platform, of course, and creating those new features that are going to expand the experience, that are going to make sure that we're not leaving anybody behind because of digital literacy or other health disparities. Virtual rooming here, that's an example also. Sometimes patients need a little bit more hand-holding. They need a little bit more guidance to make sure that those video encounters are successful. So it's really a comprehensive and multifaceted approach to making sure that we're addressing those needs. And again, very excited to partner in the Lifeline program that is very much part of this strategy. And I think those are the main points I wanted to highlight, and open for any questions that you all may have.
Thank you. Thank you very much, Evelyn. We are super excited to partner with you and to provide help and support to reach these kiddos who are underserved and families that are dealing with very challenging social determinants of health. And one of the big issues, as we all know, is the digital divide and the lack of access to broadband. And as much as telehealth can be an enabler of greater access, it can also be, unfortunately, an accelerator of disparity if these families don't have access to hybrid models that include virtual care. And it's terrific that there's the FCC Lifeline program, and Pulsewrx is a partner that we've been working with. They do a tremendous job making phones and broadband services available to people, and matching up the two programs is a very exciting opportunity. And I want to turn it over to Ali to tell us more about the Lifeline Wireless and Affordable Connectivity Program. So take it away, Ali.
Thank you, Boyd, and thanks so much, Evelyn, for giving that introduction as well. Hopefully you can all see my screen. Boyd, please interrupt me if you cannot. Again, my name is Ali Leverson. I'm with the Pulsewrx organization. I'm here to discuss the Lifeline Wireless and Affordable Connectivity Programs, specifically for telehealth services, but other social well-being and health services that we're partnering with to make available for free. So our organization's mission is to bring mobility and accessibility to underserved populations. We specifically have been involved in the Medicaid industry for many years and primarily serve organizations that communicate and work directly with Medicaid recipients every day. But we also work with any other eligible programs that qualify via the Lifeline and Affordable Connectivity programs. We strongly believe, regardless of the eligibility program, that mobility and connectivity and wireless access is a social determinant of health and well-being. And so it's our mission to make it simpler, easier, and an improved offering for those who are eligible via the Lifeline and ACP is what we're going to call it for short program, to be able to enroll in this benefit and really take advantage of it for the health programs that are out there today, just like Evelyn spoke about. So what is the opportunity for connectivity? Many of you might be familiar with the Lifeline Assistance Program. It's been around for many years, actually initiated in the 1980s. It's an initiative to bring phone connectivity and broadband access to low-income populations. That includes all Medicaid recipients. Medicaid is one of the universal programs. It says if you're a Medicaid member, you're automatically eligible for this program. You might hear, as I just mentioned, that oftentimes we also speak about the Affordable Connectivity Program, or ACP for short. This is additional funding that the federal government provided to bring connectivity and enhanced access to wireless connectivity to households all around the United States. So they are interchangeable. They are both the federal benefits that enable this wireless connectivity. As I mentioned, it is our goal to make sure that every Medicaid recipient, or even every eligible household, has the opportunity to enroll in this benefit. When we first got introduced to this federal benefit and involved in the Lifeline industry, we looked at the market as a whole and said, why is every Medicaid recipient not enrolled in this program? There's universal eligibility. They should all qualify as they do and be eligible to enroll rather simply. And we found actually that the penetration of the market among Medicaid recipients was very, very low. And we dug into why. And it became very obvious to us the hurdles that are in place for Medicaid recipients and other low-income populations to actually enroll in the benefit that gives them access to connectivity. So first, to enroll in the benefit, most recipients or eligible beneficiaries have had to go to a wireless store, so physically travel there, work with an agent, or enroll online. So they were required to go online for very technology that gave them online access. So as you can imagine, that created a giant hurdle for much of the population. We also found that historic Lifeline plans, so when we're talking about minutes or calling minutes, text data, whatever that is, was very antiquated. It did not provide proper connectivity in 2022, let alone 2020 or pre-pandemic. It was limited in minutes, it was limited in call minutes, texting sometimes didn't provide, surfing the internet and wireless connectivity that is needed to be fully connected in today's environment. So we're looking to change that. And what we do is we partner with really great organizations and stakeholders around the nation to make this benefit more available to your program's community and to make it simpler to enroll. So we partner with you to make the benefit more available and more accessible to your community. And then we align our approach and our project planning and our offering to what works best for your community. And I'll discuss that in just a minute. First, what's important to understand is the improved offering. I talked about the phones that were limited in text and calling minutes and wireless connectivity, and we've changed that. We're going to be offering a free smartphone that includes unlimited talk, text, and data. The data it's universally unlimited for all of our recipients. However, depending on the state and if an individual resides on federally recognized tribal lands, the high-speed data included in that plan will differ slightly. We also custom provision each of the phones attuned to your program. So for a telehealth program, we're going to put those mobile applications that your program utilizes to connect with your community. We might include other resources that are available to your community, like the public library or something related to the food bank or MyChart to access their health records. Whatever is useful for your program will help provision those phones to reach your community preloaded with those important health and social well-being mobile applications, as well as contacts for that matter too. So while these phones can be used for telehealth services, they also enable connectivity with anything that recipient needs. So it's not locked down, it's not specific to certain initiatives, it is their phone to connect with telehealth, but also to connect with friends and family, school, work, and other governmental resources. Here's where our process comes in. This is really what we're passionate about. It's how can we reach the community that needs the benefit most to also benefit a program that you're also running. Like Evelyn mentioned, the Teledental initiative, or working with those families who report food insecurity. We want to work with your organization, and we'll work with the Nicklaus group to identify how you're already communicating with your community and how we can align our approach to fit that daily communication that you already have with those families and those households that are universally eligible for this benefit. So that's what we do. We help train those individuals who are interacting with Medicaid recipients or the program beneficiaries every day. And we allow them to be successful in guiding the eligible individual through a guided self-enrollment online. So again, providing that technology to enroll, providing need-to-know tips to be able to connect with that federal benefit and successfully enrolled. We've also created custom websites specifically for these initiatives. We've removed the requirement for Medicaid recipients who are found in the back-end system of this federal database called the National Verifier to upload documentation. That alleviates a giant hurdle for many people who don't have documentation on hand. And that's for those individuals that are found in that system. Doesn't work every time, but it is a hurdle that's alleviated again for this population. We also have mobile apps that we can help your team preload on their smartphones or maybe a community iPad or tablet that you have available that individuals can help enroll in the benefit. And then lastly, as I mentioned, we are here to serve your programs to promote telehealth resources and other programs that are really making health more accessible for your community. And so we'll deliver a project plan. We'll help walk you through what is needed in terms of preloading those applications on the phone, making sure that we can give phone numbers back to you to reach those patients that you've helped enroll. Anything that you want specific to your program, including marketing resources and training resources. We work with you to understand that. And that's what we were really passionate about. This program, meaning the Lifeline and Affordable Connectivity program, works best with it, and it's aligned strategically with a programmatic effort, something else that the community really needs and is working on to promote that health access. So that's where we come in. We're really, really honored to work with Evelyn's team and Boyd's team to make this available both for the Nicklaus team and many other organizations around the nation. So at this point, Boyd, I think we can turn it over for questions.
Terrific. Thank you very much, Allie. One of the key points that I would like to emphasize, and you heard Evelyn and Allie mention it, is the aspect of alignment and partnership. You know, taking on the challenge, as many people on this call do every day, of providing healthcare services to folks who are in need of it, and especially for children, is a challenging undertaking. And there are a lot of challenges out there in the environment. And it really takes a partnership and programmatic alignment, as Allie said. And we're excited that the group that we have here together with Pulsewrx and with Nicklaus Children's Health System and with the Southeastern Telehealth Resource Center, we feel like we have a very strong team, and we're going to deliver for the folks who need it the most. And it's very exciting. So thanks to Allie and to Evelyn, and definitely would like to open up to any questions. If not, I have some questions. Allie, could you tell us more about what I think is really a catalyst to some of this, and that is your organization's ability to provision these phones with applications that are specific to programs. For example, in this case, as we from Evelyn, Nicklaus has devoted a lot of resources and a lot of expertise to creating applications that best serve the needs of their clients. And being able to deliver those phones to the participants with those applications on them is really, I think, just a huge catalyst to making the entire thing more effective. And that's no small endeavor to deliver pre-provisioned phones with customized applications. Can you tell us more, please, about how that works?
Yeah, great. I think it's really something that sets apart this program and allowing you to have the confidence that the individuals you want to have this phone and who have opted into the benefit will get a phone ready to use for the program needs that you've identified and that we can align with. So what happens is we work with you very early in the process to identify mobile applications, phone contacts, website browsers, anything that you need or that the recipient will need to communicate with you or the community. So that is very simple, and we call it our custom phone provisioning list. I usually initiate the planning of it by sending you a worksheet to start thinking about those applications and phone contacts that you'd like on the phone. So I've mentioned a few, some of the telehealth resources and those mobile applications, anything that connects with your health system and MyChart, or even a fitness app or step counter. We've also worked with organizations that have identified free ebooks that would be really beneficial to come preloaded on this phone, as well as contact numbers. So for example, you know that you're working with patients and you're going to contact them regarding member services. So when they get that phone call, I just got one maybe 5 minutes before this webinar started, and it showed up as spam. Well, we don't want your number to show up as spam for your recipients. You want them to receive the phone number as that trusted resource, as the Nicklaus Children's Hospital phone number, so that they know to pick it up and not ignore it like I just did. So having that phone provisioned with those phone numbers, the contact information, mobile applications, and other resources really makes it a better phone, a more useful phone. And I'm more likely to use something that's already been preloaded for me and I can check it out and utilize it. Keep in mind, these phones can add or delete any apps that the consumer wants. So if they receive the phone and they want to add Facebook, by all means, they can add the Facebook app. But it does set your health program and your initiative up for success so that they already have it ready to go.
Fantastic. We do have a question from Emily. She asked, do we have an example of what the platform looks like for a virtual dental app? And I have to say, unfortunately, Evelyn had to sign off. She would be the best person to answer that. I do know that they have developed an app specifically for their teledental program. And we'd be happy to follow up with you, Emily. We probably have your email address, or if you want to put it in the chat, we can follow up with you with more information. Thank you. Awesome. Okay. And so, Allie, are there, if anybody on the call wanted to contact you to get more information, could you drop your email in there too,
That'd be
please?
great. Yep, I'm putting it in right now. Yeah, and feel free to reach out. We're always eager to hear about other programs, give you more information about the federal benefit, and understand how we can help your initiative and your program. We can go along with that. 1 second, I'm putting this in.
And Emily also asked, what is the website for the Medicaid members? And I'm thinking that's the National Verifier site, but Allie's the expert on that.
Yeah, thanks, Emily. So what we actually do is it depends on the program. So if you were to go to, and I'll put it, let's see, Boyd, I might need your help in transferring the communication. I think I'm just sending the information to the hosted panelists, not to all attendees. But when we launch, like if anyone were to go on the website right now as an eligible Medicaid recipient, they can go to govphoneservice.com, enter their email address and zip code, and enroll in the benefit. What we do with individuals and programs that we're working with is sometimes we will create vanity URLs, sometimes we'll create custom websites that you want to use for your program. The advantage of this is that we can identify the traffic to that website. We can help you connect with how many people have enrolled in your program. And what we call a referral ID, we can tie that program with the enrollee. So we work with you, that's part of the project planning, to understand if you would like a custom website, a vanity URL, or even like a portal within your internal website on your back end. We can deliver that to you. But GovPhoneService is this .com is the starting place for that. And I'll put that in the chat as well for the team to communicate back.
Yeah, I was very pleasantly surprised when Pulsewrx showed me how they have a website set up, and Medicaid recipients can go on and really just in a matter of maybe 5 minutes or less go through this process. It's automatically connected to the National Verifier, and they answer a few questions, and I mean, voila, a phone is going their way, and it's really quite impressive. And I think, again, it's an example of the power of partnership with Pulsewrx really understanding how to get these devices into the hands of people easily, working with Nicklaus, who has a programmatic approach in place. They're already dealing with these populations. And, it's bringing these components together in a very targeted and organized way that I think is going to really have an impact. And that's what we're excited about.
Yeah, one thing to add there, Boyd, is one of the first steps that we'll do with the Nicklaus team once we get started is what we just call it training. And we walk the Nicklaus team through every single screenshot of the enrollment process on the website. An enrollment takes 3 to 5 minutes. It's really simple, but it's helpful. And we find that people are more successful in completing the enrollment when they know what to expect. And so we give little hints and tidbits of how to be more successful in the enrollment. For example, making sure that the residence address that the individual enters in the form matches what's on their Medicaid file or their other program of eligibility file. So we will host that training with your organization. We set up 20 to 30 minutes. I allow plenty of time for questions, and we walk through that process so your staff can be experts in it. And then as they're guiding an eligible recipient through the self-enrollment process, they can answer any questions. Keep in mind, my team does all the customer support, so we are also available, and we give our phone numbers and our email addresses out for support as well. But it does aid in program success when your staff is really informed on what the eligible recipient will need during the enrollment process and what the stages will look like for approval.
Fantastic. It has been really streamlined, and we appreciate everything you guys are doing over at Pulsewrx. You're great to work with. And we don't even have time today to get into the exciting topic of research. However, that's a pretty high item on everybody's list. The ability, of course, to be completely compliant with all HIPAA and privacy regulations, and to still be collecting really good data, and to be looking at these populations and to introduce variables where we can determine what is the best way to get adherence to the program. What are some things that we can do that can really make a difference in delivering services to these folks who are struggling to get access. The combination of having a really well established program through Nicklaus, having a really well organized program with Pulsewrx, being able to collect data, it's pretty exciting. And well, we look forward to keeping everybody posted on how it's going. But looks like that's all of the questions. And what do you say, Aria? Should we call it a wrap?
Yeah, sure. Thank you, Boyd. I'm just going to bring up just a few closing slides to finish it up here. There we go. Just as a reminder, our next webinar will be on telehealth development and expansion at specialty pediatric health system, and that will be hosted by the Southwest Telehealth Resource Center. This webinar will take place on November 10th, which does deviate from our usual third Thursday schedule, and that is because of a conflict with our SETRC Telehealth Research Conference. If you're interested in the SETRC conference, event registration information is also available for that on our events page. And lastly, we do ask that you take just a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to our speakers today for their presentations, and to the Southeastern Telehealth Resource Center for hosting today's webinar. Have a great day, everybody.
Thank you. Bye.